Now, let me tell you a little bit about my story and how I got into Medicare. I know most of you know that with me from real estate, and I still am real estate, but this is today is United Healthcare today, and it's part of what I do. Even if I didn't get paid for it, I do this because I have a passion for this. Helping people, telling people their different choices and things like that. And that's because when I turned 65, years ago, a little while ago, I was so inundated with so many choices. The phone ringing constantly. People telling you to do this, do that, do that. So I said, I'm going to find out exactly what I need. And initially, the first time, I enrolled in one that somebody told me on the phone to enroll in it, so I did. I later found out that was the best plan for me. So what we're going to talk about today is options. A lot of you already are, well, let me put it this way. Some of you are already enrolled in Medicare, but those of you who are not, rating of 5 points for this area. United Healthcare leads the way in Medicare. They are the only ones that carries the AARP logo. So that still says something to me. So let's just jump right in. And at the end, I'm gonna have an open for Q&A. If anybody has any questions, but we're gonna jump in now. And what I've done, I have a website and I also have a Facebook page. And a lot of times people will go in and they will send me a message about Medicare. I have a frequently asked questions, so I've gathered a few of the questions. And lo and behold, would you believe last week, I'm going to tell you, Jerry, I got a call from a lady in Sydney, Australia. I said, how did she get me? She wanted to know, she's American, but she's going to be moving back here. I can get back to something. She's going to be coming back here, and she was asking me about Medicare, and she saw it on my website. So I told her she'd get back in town. Basically, what she was saying, in Australia where she works, she doesn't have Medicare because it's only in the United States. So she wanted to know when she gets back how she could apply, and I told her just to give me a call. So I was excited about that. Now, again, so let's just jump right in. And what I did was I gathered 5 questions that I compiled from people talking about Medicare on my website. And this was one of the questions. I have a Medicare card, but it only has Part A. What do I need to do to get Part B? Anybody had that situation? I know you did. Yeah. So the answer is you have to apply for Part B. Part A, you're entitled to that. You work 10 years, you got 40 units, you're entitled to Part A. But Part B, you have to apply for it. What I do, I send people either to Medicare.gov, I send them to Social Security, or I will email them the form, which is the CMS 40B, which helps them enroll and they can mail it in. Now, with this pandemic, naturally, when people go to Social Security, you gotta wait, or either they make an appointment for you to come back or call them, but the doors are not open now. So it's been very difficult to get connected with Medicare. But that's one of the options that I offer to people. I will help you walk you through the process of how to get me, because it's not easy. And let me just say, nothing about Medicare is easy. Very difficult. You got to navigate through so many processes. It is one of the most underfunded programs in the government. Reason being, the government sends you all these forms, Medicare.gov, Medicare you, but when you go through it, you really don't know what to do. It's just so many processes. And so many things. Sometimes you can enroll, sometimes you can't enroll. If you do this, you're gonna get penalized. So that was the lesson I learned when I started studying Medicare. And like I said, I'm passionate about it now. And I want to teach others and show people how they can enroll without any headaches, penalties, etc. So the next question was, what is the best plan for me if I'm on a budget and want the best insurance that I can afford? Well, we're going to go over that, but I did want to say I ask questions. And the two questions I ask people is, one, are you on a budget and you want to be at a minimum amount of money going out of pocket? And it depends on your health. If you, and I'll use this for example, if you have a doctor that you've been working with for 20 years and you have heart disease, and you turn 65 and you want to get the best insurance. Now, I would not recommend you get an insurance and change doctors, because that's a doctor you've been with for years. So you may not want to go through that process. But again, we'll put a little highlight on that in a minute. The next question is, if I enroll in Part D late, what type of penalty will I have to have? Now, there is a penalty for enrolling in Medicare late, particularly with Part D. If you have credible insurance, and I'm explaining this briefly, if you're with C&P, well, not C&P anymore, Verizon. I used to work at C&P. Then with Tyrone. Anyway, if you're with Verizon, and you're on your husband's insurance, and your husband decides that he's going to retire. If you don't get insurance, credible insurance, aside from what you had within 63 days, you are penalized at late penalty. So in other words, if your husband, your insurance changes, you want to make sure that you get some insurance, particular prescription fee in that time frame. Or you got to pay a 1% penalty, which could mean, it might not seem that much, but it adds up eventually. And the last question I picked up from my frequently asked questions on my website is, what is a Medicare supplement and a Medicare Advantage? I thought both are supplements to the original Medicare. So we're going to go into a little spiel on that, but that is the fifth question that people ask me most frequently. What's the difference between Medicare supplement and Medicare Advantage? I thought both of them were supplements. And in essence, they really are, but they just have different meanings. A Medicare supplement, well, let me go with the Medicare Advantage first. First of all, I like to say this: one size does not fit all. And Medicare is for an individual. It is not me and my husband. It's your own personal individual. You have worked 10 years in the industry and you have a right to Medicare. You're entitled to that. Okay, let's talk about the Medicare Advantage versus the Medicare Supplement. Okay, first of all, Medicare Advantage, both of these, let me put it this way. Both of these are insurances. Your original Medicare, let me get it right now. When you get A and B, you have original Medicare. Now, you have to get something to supplement that, because this only covers 80%. So you have to get either a Medicare Advantage or supplement to offset that 20%. If you don't, Medicare Original does not cover prescription drugs. It does not cover dental. So you have to get something to supplement that. So let's talk about Medicare Advantage first. I personally have Medicare Advantage. I love it. These are the pros and cons. A Medicare Advantage, you must have a primary care doctor in a network, which means that you have to have a particular doctor that covers Medicare Advantages. Okay. Most plans, I'm going to tell you the pros and the cons. Most plans have zero premium. The downsides of a Medicare Advantage: the first 5 days that you're in the hospital with a Medicare Advantage, you are responsible for the 5 days. However, just put a pin beside that, because I got something to offset that too. but I just want you to know. Most plans include prescription drugs. All of them are offered by private insurance companies like United Health, Humana, Aetna, all of them. And all of them you must have your A and B before you can enroll in that. Now, this $148, we're going to talk about that in a minute too. Now, let's talk about the supplement. I might go back and forth, but I want you to know the difference. So what is the supplement? The supplement, the flexibility of having a supplement is you can go to any doctor you want to in the United States, as long as they take Medicare. Again, you must have A and B. Most of your plans, you do have to pay a premium for. And in this area with United Health, depending on other things, you might be paying $115 to $120 for a Medicare supplement. So let's just say $115. A Medicare supplement does not cover a prescription. Keep that in mind. When you get a supplement, you got to get a prescription to go with it. On the average, that might be $32. Using for example. And a Medicare supplement doesn't cover dental. So you might have to get a dental as well. So let's just say $20 now. This is just guesstimate. So 7, 4, 5, 6, $167. Now remember over here, what's the advantage over here? The zero premium. And you might say, that doesn't make sense. I don't have to pay anything over here for Medicare supplement, Medicare Advantage, but over here I got to pay all of this. Well, it just depends. And my question to people is, what is your budget? Do you want to pay money out of pocket, or do you want to pay as you go? The Medicare Advantage is what I call pay as you go. So in other words, I go to my doctor. I do not have to pay for my primary care visit. I do not have to pay for my basic health care, generally speaking, the initials. You get your blood work out. You don't have to pay for that initially. However, if I do go to a specialist, I got to pay $35. So that's the reason I say pay as you go. I go to the doctor twice a year. And I think most people who are proactive about their health, they will at least go twice a year, at least. So, having said that, they will choose to go with a Medicare Advantage, pay their doctor twice a year. So let's look, for example, you go to the doctor 6 times a year, to a specialist. 6 times 25 is how much? How much is that real quick? 150. 150. But you have paid $115 every month. You don't pay for this. You don't pay for this. So this is $167, whereas this is only $35 a month. You have to go to the doctor. My personal preference. The other thing that I like about a Medicare Advantage is they are proactive about your health. It's by design for you to be proactive, to go to the doctor, to get your health care, to go get your every other, like I said, just continue to go to the doctor twice a year. But the other thing about this Medicare Advantage, your prescription is included at no cost. You don't have to pay anything for your prescription. Your dental with United Health, these plans here, you get $1,500 worth of dental care. Has anybody used it yet? Going to the dentist? Really? You trying? Okay. Okay. So that's a good thing. But to me, it adds so many other things because I try to be healthy. I try to exercise. It has a gym membership and it's free. I told somebody about that earlier. This membership free. I go to the swim RVA water aerobics twice a week. I don't have to pay anything. So that's included in that. Let me see, what else is included? Okay, it's right here. 0 monthly payment, dentist, comprehensive dental services, allowance toward eyewear, your primary care visits are covered, coverage for lab services covered. So in my thinking, I think this is the better play. But like I said, I always take the time with the person and ask them all the questions. I ask them questions like, what is your budget? I ask them questions like, if you have a preference of a doctor and don't want to change the doctor, let's look your doctor up, see if your doctor's in the network before we choose this plan. So I'm just proactive about this, but I understand everybody might think there's other plans as well. So those, we're gonna talk about this 140, 148. Everybody that has Medicare pays Plan B. Plan B is $148 a month out your check. A lot of people say, well, I don't pay anything. Yes, you do. If you got Medicare, you pay it. They just take it out your check before you get it, but you pay. So the question is, everybody pays this. This is another amount we pay here, $148. So you got the premium, you got the prescription, you got dental, and then you got that $148 that comes out your check. Plan B. But it also comes out over here too. Everybody pays $148 a month out your check. So, like I said, pros and cons. Flexibility of going to the doctor you want, or pay monthly, shoot your doctor. So, did anybody have any questions? I mean, well, first of all, did you understand that pretty clearly? You have some questions or something? Oh, you have a question, Deborah?
Yeah, I noticed that there's $148 on each side. And I've seen the commercials where they ask you, you want to get your $148 back, whatever, in your check. So my question is, what is the criteria? How do they determine whether or not you can get that $148 back?
And I'm going to put a video on real quick, but I want you to listen. It's only 3 minutes.
A lot of this information can be found in the 2021 Dual Special Needs Plans Clarity Guide. Feel free to page through it as we go, or look through it when we're done. If you have questions afterward, ask your United Healthcare licensed sales agent. They can help you compare all your coverage options so you can find a plan that best fits your specific needs. Let's get started. Let's start with a quick overview of Dual Special Needs Plans. You can find this information on page 4 of your Clarity Guide. Dual Special Needs Plans are a special kind of health plan for people who have both Medicaid and Medicare. They're also known as Dual Health Plans, or DSNPs for short. Dual Health Plans offer more benefits than original Medicare at no cost, and are designed for people who may need extra help because of their age, or because they have a disability or some other health issue. Now, all Medicare plans include coverage for hospital stays, doctor visits, and outpatient care. But as you know, there are a lot of other kinds of medical costs. That's why dual plans can also pay for things like dental, vision, and hearing coverage, and rides to and from medical appointments and pharmacies. Many plans may also include prescription drug coverage beyond the coverage you already have. On page 5 of the Clarity Guide, you'll see a list about eligibility requirements. Your sales agent will ask you 4 questions to see if you qualify for a dual special needs plan. Question 1. Do you qualify for state Medicaid? This can be based on your income or because you have a disability or some other situation. You may also qualify for Medicaid if you are 65 or older and receive extra assistance from your state. Question 2. Do you have original Medicare, which includes both Part A and Part B? This usually means you're at least 65 years old and a U.S. citizen. But you may also qualify before you turn 65 under certain special situations. Talk to your agent for more details. Question 3. Do you live in the plan's coverage area? Check with your sales agent to make sure your home address is in the coverage area for the plan you're looking at. And question 4. Do you meet the health requirements? Some dual plans have extra requirements based on certain health conditions. Your United Healthcare licensed sales agent will have this information. On page 6 of the Clarity Guide, you'll see a chart that shows some of the extra benefits you may get with dual.
the point I was making when you asked that question was because that is one of the questions I get all of the time. How can I get that $148 back into my account? And you see it on the news all the time, right? Actually, it's a little misleading because there are some people who got Medicare and Medicaid that the government pays their $148. So don't be misunderstood and say, I'm gonna call them. I'm gonna see if I can get that $148 back in my check. Only if you have a disability or if you are on Medicaid. So I want to clarify that because that's the biggest question people call. Betty said, oh, okay.
Yeah, giving us examples of the Medicare Advantage and the Medicare Supplement. I know there are different plans, so do they all work the same? So far as the Advantage and the Supplement, so far as the
That's a good
benefits?
question.
The benefits I'm concerned about.
Yeah, I understand.
As to which one.
Pretty much, yes. The Medicare Advantage, it depends. It depends on what carrier you got it from, but the premise is usually the same. Zero premium, and you pay as you go. There might be some that pay $23 or $32, but the premise is that you pay as you go with the Medicare Advantage. The Medicare Supplement is standardized. So in other words, whatever company has it, be it United Health, Humana, they all are standards. They got 9 different per plans, A through J. And depending on which one you choose, G is the Cadillac, which gives you a lot of coverage. But the advantage of the supplement is that you don't have to pay no copay or anything like that. You don't have to pay any of that. So it is a choice of choosing, do you want to pay now or pay later? That makes sense?
It's your individual circumstance as to which one is best.
That's correct. But I always walk them through the process of asking questions. You know, I've got some people, I give my girl right here, for example. She's one of my clients who has Medicare both plans. Yeah.
So when you said both plans, we get a lot of feedback. We have to speak up, you know.
Oh, okay, I'm
You said
sorry.
both plans. What do you
No.
mean both plans?
She has Medicare. Oh, okay.
I got
Go ahead.
Medicare, Medicaid, but I also have United Healthcare, Medicare, Medicaid. I'm in United Healthcare Community Plan, okay, which covers my dental, my doctor, my hospital stays, all of that stuff.
And the reason she don't mind
The
sharing.
Cadillac.
Huh?
Does she have the Cadillac?
No, she doesn't. No, she don't have a Cadillac. But yeah, the real reason that she is in that is because she has a pre-existing. Yeah, I didn't want to say that,
Yes,
but it works. It works though, don't it?
yes it does.
It works. It works.
A clear answer at the time, but I know that things change over time. My husband is going to be turning 65 this year, and he works for a small company, and they have told him that he will have to come off the company's health insurance plan and transition into Medicare. So, can you advise me on
Yeah,
that?
I can, and you're exactly right. That's another one of them crazy rules with Medicare. Medicare says that if you are with a small company and there are 20 or less employees, you turn 65, you got to get off of their plan and come on Medicare. 20 or less employees. So is your husband in a small company? Or?
Yes.
Oh, okay. He'll usually
Yeah.
get a letter. I think you had a similar situation. You don't have to share. Yeah. I was had the same situation with her working for a small company. She had to change her, when she done 65, she had to change her insurance. Another one of those crazy rules by Medicare. But you got to get in there.
So the
All
number
that.
is 20 or fewer employees.
Yeah, 20 or less employees. And that's the golden rule, you know. Now, who would think that Medicare, as big as they are, would have a little rule like that? But you got to follow everything that they say. And you need somebody that's going to help you walk you through it.
So what do you do if it's over 24?
If it's over 20, anyway, the company really encourages that. They want you to get off of their insurance and go to Medicare when you turn 65. You know, but it's one of those little thin rules that make a difference in applying for Medicare. And you need somebody to walk you through that. Sure.
Yes, ma'am.
Okay. Did I answer your question, Cecile?
Yes,
Okay.
thank you.
Betty sent me, she couldn't make it. She sent this message in. I have an appointment with my primary care next week. I also set up an appointment to go to another doctor for some more extensive work. Does my Medicare supplement pay for both appointments, or will I have to pay out of pocket? The answer is, it would depend on your plan. But in most cases with Medicare supplement, you have a choice of your doctor, hospital, or especially that accepts Medicare without a referral. And they usually, that will pay your co-pays. That's the person that has the supplement. So they pay your co-pays and things of that nature. So I think that answered her question. I'm waiting for her to come back to me to follow up with her, but that was her question she asked me to ask.
Okay, since you given us the difference between the Advantage and the supplement, I'm very interested in it because I'm just learning that my company that I formerly worked for is now really stopping the plan that I have at the beginning of September. So I'm going to have to change over to an Advantage as to my understanding from my reading so far. So with the Advantage, it like gives you the opportunity to remain with the like say your physician, you were saying so far as you must have a primary care physician. So is that like it's guaranteed, or you have to look at the network of doctors that are available and you have to say, okay, put mine, this is what I've been doing. Okay,
Right.
if I find that my physician, that I can keep my physician, whereas you were saying as opposed to the supplement, you would already know. I'm trying to understand because I was thinking that an Advantage and a supplement were the same too, but what you've been
I
telling us
know, it
today,
sounds like it's,
they're not the same. So you would still have to kind of like find out if you want to keep those same doctors, like,
right.
you know, so
Well-
that's what you have.
Like I was saying, that is what I do for my clients. You call me, you let me know what the doctors are, write all the doctors down.
That's
And I
with the
just-
Advantage.
That's the,
With the
again,
Advantage.
make
okay.
sure that your doctors are in network.
Okay.
Yeah.
Okay.
And that's the one you pay zero premium, you don't pay that each month.
Okay.
But a supplement, by the same token, you know, you can keep your doctors, but you will have to pay more out of pocket. Whereas, if I'm not mistaken, you have a supplement now, correct?
I have a supplement. Yeah.
Right.
I'm Philip Morris, a retiree, and I'm just getting information here recently
Oh, okay.
that they're
Yeah.
dropping that supplement.
Yeah.
Yeah.
Now, a company like Philip Morris, what they will probably do is they have hired a huge conglomerate to take care of their needs. But that doesn't mean you have to go with them. They just suggested that you follow up with this company. But it sounds like it's still United Healthcare or Vicon, I think, you know, just different companies.
Okay.
So-
And also, so far, it's like a dental, because I'm interested in like a dental plan, a vision plan, of course, the medical. And so I was wondering, with the Advantage, do you get those? Because I'm having to pay out of pocket for like a dental plan now.
Oh, no, it's already included. I'm gonna give you a
Okay.
book so you
All
can
right.
read it.
Very good.
You get $1,500 or either $2,000, depending on what plan you choose. The
Right.
zero premium, you get $1,500 in coverage. The $23 a month premium, you get $2,000 in coverage for a year, and then it starts all over again. I'm sorry. Then it starts all over again.
Okay. Very good.
Yeah.
Thank you.
I just wanted to let you know how it has worked for me.
Yeah, please do.
Because in the beginning, well, let me say I'm a little frugal, because I'm always trying to save. But I added up. And originally, I thought I had to get a supplement plan, and then I started hearing about the advanced plans. And what I did, I added up. Okay, what am I paying for the Medicare Part B? Then I added up what the supplement was costing, and then paying for dental and dental and prescription and all of that. And I looked and I said, well, I'm paying almost as much as I'm paying for insurance, each month. And so I went with the Advantage plan, and it's great advantages to that. But again, you have to look at your own medical history and how often you go to the doctor and what situations you have. One of the things that you did not mention about the Medicare Advantage plan is what we call the OTC
I
program,
wanted you to say it.
over the counter. And what they do, you are allotted $50 each quarter that you can go online. They send you a catalog, and you can order through Walmart. Things that we would normally buy, toothpaste, mouthwash, a lot of things you would normally buy in Walmart, you use that $50 to do it. Now you have to use it because it doesn't carry over. If you don't use your $50, it won't carry over. Trust me, I've used mine each month. Let me just give you an example. Well, actually, for these last 3 months, I've already used mine. But July 1 is coming. That's another 50.
Right.
But last month, when I ordered everything that I had ordered, I think I had about $2.75 left, and I'm like, I don't want to get that money back, So what I did, I'm looking through the catalog, and I said, you know what? I know I'm not going to find anything for $2. What I found, those little pill holders that you have each day of the week. Put your pills in it. There you go. It was $2.50, and I got it.
You're going to get all of yours.
I'm gonna get it. I'm gonna get mine.
With that, go out to you can also get the food also with that. You can also get healthy food with that.
Well, no, that's only the plan that you have. Yeah, you have to have the Medicare and the Medicaid for that.
That's what I'm telling you. But you can.
Yeah.
So she gets $500 a month.
For food.
Yeah.
Healthy food.
Right.
Yeah. So she can order food. She can buy. But see, this will be a situation where, say for example, you may not know, but you might know somebody. You might know somebody that's on disability, and they don't realize that they can get dual eligible. That's what I do. Work with them to try to figure out the best plan for them, including if they on dialysis, or if they. I just had a client recently that has Parkinson's disease, and I helped her get her on a plan that helped her with her Medicare. She got both plans. She didn't realize she could do it. So you got to do the research, and that's what I love to do. So
I wanted to share real quickly with everybody that my mom had colon cancer late in life. They told me that I would have to have the exam every 5 years as opposed to every 10. And this is the first time I've gone to the doctor or to get the colonoscopy being on this plan. And when I got there, it was early. Actually, Lee drove me. And I got there early, and anxious and excited about everything that's going to happen. And she said, it's going to cost you $200 and was less than $250.
the lady told me.
Yeah. And so I was a little bit surprised, but who's going to argue? And so, I had my card. I gave it to her and had the colonoscopy and left. And I didn't mention it to Lee until a couple of days later. And she said, you're not supposed to pay for it. And I said, okay. And I'm going to tell y'all, there's so much going on. I was like, I am not going to worry about this. And she came back to me and she said, you need to check on it. So sure enough, I did call them and they refunded me.
Yeah, so you just got to be careful. Insurance companies will take all your money if you're careful. You don't know all the ins and outs. Yeah, thank you for that, Rita. I do recall that. Yeah, thank you also. Yeah.
Since you're talking about getting checks back in the mail.
Uh-huh.
There was a situation where I went for an eye exam, and like you said, if they tell me I got to pay something, I'll go ahead and pay it. And some months later, I got a check back in the mail from them, which of course I accepted.
Yeah. But
Good morning, I'm Jerry Hall. I work with United Healthcare, and I'm happy to work with Lee. She always does amazing events. I don't know if you get her newsletter, but make sure you sign up for her newsletter because it has really great information. She also does a lot of virtual events, so if you don't want to come out, she will do a virtual event for you. She always has lots of really great information, so I really enjoy working with Lee, and I just want to thank you all for coming out today, and thank you for having me, Lee.
okay, absolutely.
Like you said, they will look at your health. They will call you, they will check on you. They even came to my house and gave me a physical exam.
Okay.
You know, and I think you're entitled to one a year. That
Yeah.
they will come to your house and give you an
Okay.
exam in your home.
Yeah. Yeah.
You say if
If
you
you
want.
want it.
Okay.
Well, yeah,
You have the
yeah.
option to say.
Yeah, exactly.
Yeah.
But, you know, and that's the whole purpose in having good insurance. We all, and I'm telling you, it's not, one thing about Medicare, they say it's one size doesn't fit all, and it's not free, but it's the best thing going. So, you know, we just have to work with it, we just make the best of it. If you have questions, you can call me. You also can book a appointment with me on my website now. You know, if you want to talk about it, just key in and I will call you back with the information and we'll go from there. Or if you have a family member or somebody turning 65 that might need my support, please have them call me. I promise you, I will work there. I will tell them everything I know and try to help them make it.
Are you able to work with people who live out of state, like in another state?
Unfortunately, with Medicare Advantage, I cannot because I have to be licensed in another state. But that brings me to my next point. I'm working on getting licensed in Tennessee because I can work in Big Stone Gap. And I'm also going to get in Kentucky. So I am working toward that. It's called the license where I can get reciprocity, that I can work in other states.
I received a call from relatives in Florida, husband and wife who are turning 65. One is turned 65, the other will turn 65 later this month. And they were very confused.
Oh.
And I could not answer a lot of their questions.
Oh, okay.
I referred them to Senior Connections
Yeah.
in their state, but
Yeah.
I didn't know if you were
Yeah.
able to.
No, unfortunately not yet, but it's my goal to get licensed in other states. Because I want to be sought after. I want people to want to. Oh, when you get your license, well, talk to me after this. I can put you in place with that too. So we can work together. He asked me that I offer insurance for people other than Medicare. Just like if you're not 65, you need help, you need some type of health insurance. Yes, I'll help you and direct that. Yeah. He just, what he's asking me is he might want to get out the car business and get into the insurance business. Okay, we can work on that. Just a little clarity. If anybody has the time, as a bonus, this is what I have done for my people here, my group. I think I sent out the invitations that you had to pay to go into the museum. If you would like to go into the museum, free of charge, from me, you can do so. You don't have to have no formal, just walk through and look through. Normally it's $8, but I'm taking care of that. Okay? All right. Thank you. Yeah.
Somebody that knows more about it, I probably would still be able to.
Yeah.
Yeah. Because I had to go to the dentist, and I found out that I saved some money that I really have to
Okay.
spend.
He said he saved some money by enrolling with me because it's kind of coincident where we did it. I was buying a car and he was in there and I said, hey, you? And he said, yeah, I just got this paperwork. They said I need to get something. I don't know what it is. And like natural, I swooped right on in and helped him out. So.
This young man was talking about
Oh, okay. She said this is the catalog, and this is I have these up here. This is the catalog, and this is you just go call your company, and these are the things that you can order at $50 a month. Now, personally, I have got a blood pressure monitor. Costs about $40 to $49. You can get the thermometers. You can get a whole lot of stuff. So that's anybody else need one?